No, I'm watching the numbers slowly creep up, so I might start. So really lovely to be here today. As I said, we're in the room, so you can see the panelists who are in the room, and also Sheridan, who's on the Zoom room live. So my name's Anna. It's a real pleasure to welcome you in person and virtually to this webinar. It's a really exciting webinar from my perspective. We're having a panel discussion today to really try and drill down into really essentially how do we bring our academic and our policy and practice experts together to think about what types of evidence do researchers need to develop for our partners, what types of evidence do our partners value, and how can research really support the aims of our policy and practice partners and our food retail partners to bring about that wide-reaching food environment change that we're all looking for. So I'll introduce the panel shortly, but I did want to first start with an acknowledgement of country. So I'm joining you from Wurundjeri country, and one of our panel members is in Brisbane. So I'll start by an acknowledgement of the Wurundjeri people of the Kulin Nation and pay my respects to elders past, present and future, and all Aboriginal and Torres Strait Islanders who are with us today, virtually or in person. A little bit of housekeeping before we start. So online attendees, please feel free to put your questions to panel members into the chat or the Menti, I'm getting the nod, and our online moderator will facilitate those questions when we come to audience question and answer. And I'll also be taking questions from the live audience that's here in the room today. So as I said, today's event is really exciting to me. So I'm the director of both the NHMRC funded Centre for Research Excellence in Food Retail Environments for Health, or REFRESH for short, which has been a 5-year research program really focused on building the evidence to transform food retail environments to be healthier. And our 5 years of funding is concluding in the next couple of months. So to celebrate that, we've partnered with the Nourish Network, of which I'm also the director, which is a network which Victoria Hobbs will tell you more about soon, but really strongly focused on bringing together retailers, policy practice partners and researchers to do action-oriented responsive research to make a difference. And so today we really wanted, as I said, to drill down into what makes that kind of research work for all those involved, and particularly for the benefit of the community. And so our partners today are going to really be discussing from their different perspectives how they've used research, built research, inputted into research, and how they would like research to continue to support them to improve the health of food environments and deliver evidence-informed health promotion strategies. So I'd like to start by introducing our panel members. And I'll start with Sheridan Clough, who is on the Zoom room. So I will introduce all the panel members first, and then we'll start with some opening questions. And then, as I said, I'll throw to all of you for questions. And we've got about an hour. We're going till 2:30. So Sheridan, it's a real pleasure to have you here. Thanks so much for Zooming in. Sheridan's a senior dietitian nutritionist at Health and Wellbeing Queensland. She has a background in exercise science and dietetics, and her work focuses on the development, implementation and evaluation of programs and policies to improve community wellbeing. Sheridan's particularly passionate about food environments and how physical, social and sociocultural factors can influence people's food and drink choices. Sheridan's the project lead for Health and Wellbeing Queensland's A Better Choice initiative, which focuses on improving the availability and promotion of healthier food and drinks in public settings. She's also the policy partner on the current research collaboration between Health and Wellbeing Queensland and the Deakin University-based Refresh team, looking at a randomised pilot study testing a set of co-created tools aimed at supporting Queensland retailers, health practitioners and other stakeholders to implement a better choice and improve the healthiness of food retail environments. So welcome, Sheridan. I'd also like to introduce from my far right, Dr. Talani Skapin. She's a research fellow at the Global Centre for Preventive Health and Nutrition at Deakin University and a member of the Refresh CRE. Over the past 8 years, she's conducted mixed methods research on a series of public health nutrition related projects with a particular focus on food labelling, consumer behaviours and strategies to promote healthier eating within food retail environments. Her research, which we'll hear a lot more about soon, has been developed in collaboration with a diverse range of partners, including food regulatory agencies in Brazil, public health groups and agencies in Australia, and more recently UNICEF in the East Asia and Pacific region. Her current work involves serving as the project manager and research partner in a multi-country initiative led by UNICEF East Asia and Pacific Regional Office. Bridget Anwar, in the middle, is an accredited practicing dietitian and nutrition policy advisor at the Healthy Eating Advisory Service at Nutrition Australia. She leads the implementation of Victorian Government's policy directive for all Victorian public health services and is currently working with all 81 public health services in Victoria to maintain that policy. Congratulations. Bridget is passionate about using a systems approach to build sustainable policy implementation and to address barriers to healthier food provision in health services. She's also a member of the Nourish Network and supervises Deakin University Masters of Dietetics placements. Welcome. And last but not least, Victoria Hobbs is the current leader of the Nourish Network, which is, as I was saying before, a multi-sector collective working to increase demand, availability and access to healthy, sustainable and affordable retail food. It's supported by the Global Centre for Preventive Health and Nutrition within the Institute for Health Transformation at Deakin, and its research policy practice model really aims to share knowledge and co-creation of action-based research projects. It brings together communities to work alongside world-leading researchers and policymakers to shape their food environments and embed research outcomes for the long-term real-world impact. The primary focus of her work is to bring together multi-sector stakeholders to drive positive change in Australian food retail using evidence-based policy and practice approaches. Prior to her role with the Nourish Network, Victoria worked to implement the Deakin Food Charter, which guides a balanced food retail offering across the Deakin University campuses. So after all that from me, I'm going to just take a pause and check that my sound is okay, that everyone can hear me fine. And also, because I often forget at the end, to say a big thank you to those who coordinated the session today. So Victoria and Sian and Julia, big thanks for putting this together. And to our external guests, Bridget and Sheridan, thanks again for participating. And of course, to all of you at home, who hopefully will have lots of fantastic questions for our panel. So I really want to start with some general questions to the panel just to get a sense of what they feel works well in their experience with these research policy practice partnerships and where we might be able to improve the impact of our work together. So I thought I might start with you, Bridget, and just ask if you could describe a little bit of your journey with research and how you were introduced to it and some of the learnings that you've brought from it.
Working now? Yes. As a dietitian, I've been introduced to research in my undergraduate degree and was actually able to participate in a paper, which was the role of resveratrol in cognitive functioning. Not particularly relevant to anyone today. But now working in a non-clinical space, it's super important to use that research to make sure we are providing at a state level evidence-based advice and applying that to practice for health services across the state. So that's been my journey so far.
Thanks very much. And I might throw to you, Sheridan, to also sort of pick up on that same question, just giving people a little bit of context around your experience so far with research, how you were introduced to it, and some of your early reflections.
For sure. Similarly to Bridget, in the clinical dietetics degree, you do research into the way that foods interact on an individual level, but I never thought that I'd be using that in a public health setting. So as a dietitian working in public health, I use research in our everyday practice in project management in the way that we scope for projects, plan for them and evaluate them. But my journey into more formal research is probably quite recent. It wasn't until I started working at Health and Wellbeing Queensland where evaluation and research is a big part of everything we do, making sure that we've got all of the evidence to translate into practice. And particularly working on a better choice was my first interaction with Deakin and the current research project that we're doing. So it was last year, I believe, where I reached out to some of the Deakin team just to ask for support on how I can better implement a better choice, particularly in our hospital and health services. Any research resources that they have, any tips and tricks. And it was a general discussion about the objectives of a better choice and where Deakin was taking their research that led to the current project that we're working on together, which is really exciting to have that backing a better choice at the moment.
Thanks very much. And we'll obviously ask some more questions about that soon. But I'm going to throw to you, Victoria, because I think, you're really at that nexus and it'd be great to get your reflections on, for example, with a project like the one Sheridan was talking about, what are some of the things you think we're learning that make that process work better?
Yeah, thanks, Anna, and great to have everyone here. Yeah, I think the Nourish Network really works to connect people, like we said in the introduction, and develop the tools that are needed for practitioners on the ground who are working with retailers and working with communities. And knowing that that is evidence-based just provides such strength and rigour. And I think that really helps practitioners, and I'd love to hear more, when they are trying to implement those changes. So they know confidently that it's backed by research, which is peer-reviewed, and it has that strength, like I said. So it's been fantastic to help to develop those tools and connect the communities that we serve.
Thanks, Victoria. And Talani, it'd be good to hear now, sort of from the other side of the fence, whether you can tell us a little bit about one partnership that you're involved in as an example, and some of the things you've learnt from working within that partnership.
Thanks, Anna, and thanks for having me in the panel. So recently we have been developing a partnership with UNICEF in East Asia and Pacific. The partnership has been running for the past 3 years, and it's been really enlightening experience of working in partnership and collaboration with international and large company has UNICEF, and as an early career researcher, working in partnership was also something that always inspired me to get my work and the work of my colleagues in the field and to contribute to practice. And a lot of learnings during the process, especially regarding setting very specific goals and working together to achieve these goals. So it's not easy because sometimes we have different perspectives, but I think with defining goals, timelines, and aiming the same big picture, we can achieve that.
Yeah, I'd like to drill down a bit more into that, because it's a bit similar to something Bridget was saying before. I mean, I think everybody will understand that to drive successful partnerships, it is often about aligning goals and expectations. But I think one of the things we've learned through Refresh and through the Nourish Network is sometimes we don't know all our goals and expectations when we set out on a joint project. So I think what I've found really exciting in this field is there are a lot of people who clearly have the same overall goal, and we're really keen to work on a problem together. But often we're not exactly sure what that might look like when we set out. And I just wondered whether you might have some examples of where that might have been the case, where we weren't completely clear and we had to kind of clarify as we went, or some tips and tricks that you've learned along the way about how to make sure that the goals are clear and we are aligned as we go. And I might start with you, Bridget.
Sure. So I guess through my work, I work with a policy that's a policy directive, and that's one thing. But how do we make that practical for our implementing audience, which is health services, and there are 81 of them. And many people in this room have touched the policy directive from a research perspective in many ways, and that is super reaffirming to us, I guess, in the sense of we have these really strict deadlines, we have these objectives that we need to achieve, and being able to approach health services and provide health services with resources, particularly that we know are evidence informed and evidence based, based on things that are happening in this state, with Sheridan in Queensland, but also internationally as well. So I guess that's a really important role of research in, we've got these tight timelines, we're trying things, we're experimenting, we have to give it our best bet, and often that's with research that's been informed by this audience. So,
and Sheridan, do you want to add to that?
Yeah, thank you, Anna. I think what Bridget said about that contextual evidence is really important, particularly across the states where we're doing a similar thing, but in a slightly different way. We're realizing that processes can look quite different. And particularly with retailers, we want to know that we're giving them something that's going to work for their specific circumstances. But I think the other side of that too is the way that we impact the end users. In a way, public health is almost similar to a business in that consumer impact and acceptability is the most important thing. We're here to service the community, and we want to make sure that we're contributing to bettering their well-being. So I think when we're planning for programs, activities, and research, we want to know that it's actually going to have an impact on the Queensland community or whatever setting that you're working in. And that's really hard for us to plan for in our evaluation program, because it's hard to get that impact evaluation. So I think that's where the role of the research really fits in, and making sure that we're planning something from the outset that is fit for our particular target group.
And Talani, you kind of mentioned it in your introduction, having those specific goals and making sure those goals are clear and aligned. Do you have some more kind of examples of how you actually made that happen?
Yeah, for sure. So in the UNICEF partnership project, for example, we have been working with the regional office in East Asia, but also with country offices in 4 countries in Asia, including China, Indonesia, Philippines, and Thailand. And sometimes because we have a big group of people working together in the same project, it's quite hard to align these goals. So we define, for example, a steering committee meeting where we all come together every 2 months and we revisit all our plans, and then we make new plans for the next months and we make sure everyone is the same page. So we keep checking with them if you're on the right track, if everything is going according to the plan. Sometimes things doesn't work and then we revisit that and then we change. So I think that's a good example of how we communicate truly and make things happen.
And that's a great segue to Victoria. I mean, I think communication across the Nourish network has been one of the things that we've thought a lot about, both internal and external. Did you want to give us some thoughts from you on how we can make sure we are communicating really well across all stakeholders so that goals are aligned, but also we can deliver impact?
Yeah, thanks, Anna. Yeah, communication, absolutely so important. And that's what we have found. It's obviously a very busy, noisy world. There's communication coming from everywhere, messaging, and the health messaging and sustainability messaging that we're keen to communicate. We've been working to figure out the best channels and how we can get in touch with our audiences. And I think a strength of Nourish is that we do convene communities of practice and interest groups. So people who would like to learn about the resources that are out there and participate. And also we seek their views as well, the practitioners, because as Bridget said, we have people working with retailers and retailers themselves, or should I say potentially hospitality. It's more terminology that's used in cafes and restaurants. To understand what they need and to bridge that gap with research in terms of, the timeframes can differ, etc. So those communication channels are really important and tailoring them to the various audiences. So.
Thanks, Vic. And one thing, just an open question, so just anybody lean into this one. One thing that I think we've really reflected on both through Nourish and Refresh is that, different partners want to come into the research process at different stages. It might be a small idea that would be directly helpful to the partner. It might be a bigger problem that we're trying to solve across the sector, or it could be something that is investigator originated that we're curious to see if it's worth testing with a partner organisation. And I just wonder whether one of you might want to start the ball rolling on thinking about an example of a research partnership that you've been involved in that reflects a different level of that partnership. So it might have been that small idea that you directly went to a researcher with, or it might be a big idea that came from a partner to a researcher. Does someone want to reflect on that?
Thanks, Hannah. So at HEAS, we've been involved in an honours project with Deakin, looking at, I guess, healthy choices and policy directive implementation in health services. And for us, we know we do these things every day, but to have these documented and put down in research has been so important, because that it's not documented, somebody else can pick it up in another way and look at it and learn from it. So I think that process of having things, our business as usual, formally documented is really important in the process. So
thanks, Bridget. Anyone else want to add to that one?
I think, again, going to the example from the UNICEF project, everything started with a very specific setup in an agenda for health retail research in the region. And then 3 years later, we have 4 countries working together to trying to make the change in the retail food environment in the region. So we need to take these small opportunities to grow up. And that's a good example of how that happened in our case.
Yeah, I think that's a really good point. I think a lot of the partnerships that we're all involved in really have started from a small shared idea and grown into long-standing, enduring partnership with much bigger projects. Did you have anything, Vic or Sheridan, that you'd like to add to that?
I was actually going to mention that the relationship we have with Health and Wellbeing Queensland, so with Sheridan and her team, originated from the Healthy Retail Toolkit that we developed, led by the Healthy Eating Advisory Service, Margaret Rosman and her team. And having that tool, I think, really helped form the relationship that we forged, and that has then been taken into the Queensland setting. So I'd love to have Sheridan share a little bit about that one.
Thanks, Vic. I think that's one of the really exciting things about the project that we're working on with Deakin at the moment. It does feel like we're in the middle of something really big. We came into the project, like Vic said, where the Nourish Network had already developed a healthy retail toolkit, which is an amazing co-design tool for retailers to actually take some action in creating healthy food environments. And I know in Queensland, often that's put on health practitioners. So it's great to have that resource to share with retailers. So that, like Vic said, has been adapted to the Queensland setting now, and we're going to trial it in hospital and health services here in the state to see if it has an impact on a better choice. But at the same time, we're also going to trial some training that has been developed through a previous research partnership and project for health practitioners, and it's all based on systems thinking. So alongside the retailer toolkit for retailers, there'll be some training for health practitioners, and we'll see how both of those things work in Queensland. But this is just the start. I know that Deakin are really interested in evaluating the process of this particular project to see how they can expand it across Australia nationally and expand our reach in food environments.
Thanks very much. I want to turn now to another area of challenge where I think you've all got some really useful insights, and that's around capacity and resourcing. I think we've all got a lot of experience collectively, I think, in the room and on the Zoom room with partnering with people who have really aligned goals and wanting to make a difference, and then running up against sort of capacity and resourcing constraints. And I think they're common constraints both in public health and prevention practice, but also in research. So I just wondered if you might each reflect from your vantage points on how bringing together these partnerships and these growing partnerships can actually contribute to the capacity building and overcome some of the resource constraints. And I might start with you, Sheridan, online.
Definitely. I think we can always do more together. And this particular research project has been a great example of that because it's created capacity across the system here in Queensland. Starting with Health and Wellbeing Queensland, we have resources now that we didn't have before that we can offer to our hospital and health services to help them implement a better choice. And then for me as an individual, I'm building my knowledge, understanding and capabilities in research, particularly in the food environment space. I think the other thing that's really important is that this particular research has actually created opportunities to build the public health workforce here in Queensland. Deakin's been able to hire a couple of Queensland-based research assistants to help us with the project, and those positions are few and far between, so it's great to have that opportunity. And I think also for the hospital and health services, obviously this is providing them some capacity, which is most welcome. They have support with their auditing, their annual auditing against a better choice, which is a huge time burden for them. So that's something that they have been offered. But at the same time, they're building their capabilities for individuals in retail outlets and health practitioners to help make implementation easier moving forward.
Thanks very much. And before I throw to you for the same question, Vic, I might just add, I think one of the interesting things about this project has been how opportunistically we've looked for resources to continue to build what we knew both through Nourish Network and, as Vic said, the leadership through HEAS of the original toolkit, and then through our partnership with Health and Wellbeing Queensland. Everyone's been very clear that these are projects worth developing. And so we've all kind of scavenged from wherever we can within our own organisations, but also just reflecting on a few small pots of money we've got to support the research. One came from the Victorian Department of Health, one came from the National Prevention Centre, and one came from Deakin University's internal research grants. And it's interesting, I think, that over time, there's really greater support for research with partners that is clearly going to make some real world impact. And so while we do have to scavenge, I'm kind of optimistic that there might be more avenues for this kind of research funding. But I will throw back to you, Vic, to touch on your reflections on how these partnerships either might be challenged by or might support capacity building.
Yeah, thanks, Anna. I think we've all worked with partners and we realise, it can be challenging, there's time constraints, etc. But it's such an incredible opportunity to co-design resources that work. And just to take a project that Nourish Network is also helping to support, it's the development and expansion of the Store Scout app that was originally developed by Julie Brimbercombe's team and now by one of our researchers, Bettina, and we have reached out to local health services to help adapt and test that app. And that will be supported by students. So in terms of resourcing, it's great to build capacity. I think nutrition and health students, public health, they are looking to gain experience, and it's a fantastic avenue for them to do that and understand real world settings. So in terms of capacity, we also love to work with health services and health promotion practitioners to help them contribute to their objectives under their health and wellbeing plans. And knowing that we're helping to further that work is really, really exciting. So there are many opportunities to contribute and to help build capacity.
Thanks, Victoria. Would you like to add to that question around capacity constraints and opportunities?
I'll touch on the opportunities perspective. I was saying this to Anna before, we don't have capacity at HEAS to have someone that's dedicated to seeking research. So having a group such as the Nourish Network or tapping into researchers and knowing, okay, when we're pressed for time, either to explore a research opportunity or to seek the latest evidence, it's a reputable and reliable place to look. Quick information, something validated, partnering in something. So I think that's a real opportunity of having everyone sort of affiliated in the same place.
Thanks very much. Talani, have you got some thoughts on this one, capacity building?
Sure. So I came from the other side, from the research, and I think the capacity building through the UNICEF project, for example, it's a good example how we are helping and being helped by people in the field to get our work to the hands of those who need it most. And also we have some other projects through Refresh. For example, we have a health retail food environment short course. I think Bridget attended to that training, which helped to get the knowledge that we gather through Refresh to the hands of those in the practice. And that's a good example how we can deliver some capacity building through practitioners as well.
Yeah, thanks very much. And I would also add, so obviously one of the goals of this webinar is to share our reflective experiences, but also we do want to hear from those in the room and on the Zoom room. So do think about your questions for the panel as we're talking. But one of the other things we'd love your thoughts on is, through Nourish Network and this researcher network more broadly, we think a lot about how we can provide that capacity and that support. And so through Nourish, we've tried to build quite a lot of backbone support that I'm going to ask you to talk a bit more about, Vic. But we'd really like feedback on that. So I think, one of the interesting challenges in this space is what is the backbone support that is most useful to build these collaborations. And so I will ask everyone on the panel to reflect on, in a wish list or a perfect world, what is the kind of support that organisations like the Nourish Network could provide that allows you to do more of this partnership research with impact? But Vic, do you want to talk a little bit about the backbone support that we provide?
Yes, so I think Nourish Network really offers a platform for sharing and contributing. There are loads of great, passionate people out there who are keen to work on initiatives together with practitioners, connecting researchers, retailers, and health promotion practitioners. So we offer communities of practice where we consider a specific area. For instance, Vic Health chairs our Healthy Supermarkets Community of Practice that was previously convened by a regional health service in Bendigo, and that has really expanded. We have supermarkets who come and talk about their perspectives and obviously how we can positively influence those settings. So Nourish Network also offers interest groups where we can form projects to look at a specific area where we can help positively influence sustainability and health in those settings. So if you do have an area that you would like to work on in terms of healthy food retail, please get in touch. We're very welcome. We welcome interest and also in-kind contributions to achieve that.
Thanks, Vic. And Talani, did you want to give some reflections, knowing what you do, about building these partnerships, and you might even speak to a different example about what kind of support is useful to try and develop these partnerships and actually grow them?
Yeah, sure. So we have some partnerships in Brazil and Peru as well, Latin America. And growing these partnerships, it's something that is really valuable for us. As I mentioned before, it can start small, something the partners they have an idea or they have a project that they think might be good, but they don't have the resources or the methods, or they don't know how to progress that idea. And that's where I think the research partners can come in and help them to brainstorm ideas and how to develop that further with evidence base and the methods, and maybe in a quicker way, because we have experienced that before sometimes. And in this partnership that I mentioned, for example, in Brazil, where we have a partnership project with researchers to try to implement some strategies for healthy food retail environments, it all comes about like a informal talk. And sometimes partnerships start like that. So if you are a partner organization, please just come get in touch and let's have a chat about some ideas.
Yeah, I think that's a really good point. And also then thinking about making the space for those informal conversations is really critical. Sharon, did you have any thoughts you wanted to share around that idea of either support that you have found valuable, or if you had a magic wand, support that you'd like to create to drive those partnerships further?
I think what's really important for me in my role in a health promotion agency is the how. I think we're in a really lucky position where we can trust that the researchers have the what covered. The evidence is there and it's coming out in an amazing rate at the moment. But when there's so much coming by our desks, we need that contextual side of it and how it's actually going to make an impact to our community and how we're going to fit it into our day-to-day work and the objectives that we're trying to meet. So I think when evidence can come with some ideas on that implementation guidelines or steps that practitioners can actually take to apply research in their work, that's really helpful. So I know the Nourish Network has released a lot of this already, but toolkits, guidelines, evidence summaries, all of those things are really helpful in an actual practice setting.
Thanks, that's really useful. Bridget, did you have something you'd like to add?
I think just to Sheridan's point, that the practical resources and tools, and it's fantastic to have a paper, but what can we do with that? How do we translate that? How do we put that into practice? I think that next step is really important, whether it's our stakeholders that put into practice or whether it's an organization like, for Sheridan or myself, we can use that and translate that for everyday use.
Yeah, and I'd like to pick up on that a bit further actually and ask both Talani and Vic. So from the perspective of those on the side of trying to develop those resources, did you want to share a little bit of what I think might be both the challenges in resourcing those activities, but also the excitement in developing things that you can really see where they land?
Yeah, I think we are talking about that before the panel. Something that's the researchers usually are used to, it's working in front of computer all day, so we are not in the field. And all the knowledge and experience from those working in the field and the practice, it's really important for us. So develop the tools in theory is something, but in practice it can be really different. And one example is when I traveled to Peru, I had in my mind what type of tool they would like to use there. But when I arrived there, I see a completely different context, which I just threw away all the things that I was planning to, and we start from scratch, develop together these tools and things they need for the retail food environment. And yeah, I think it's really important to get the experience to the table and not only thinking about how theory things work, but also all the experience and knowledge that was previous built through the practitioners.
Thanks very much. Did you want to add to that, Vic?
Yeah, thanks. Just briefly, I think it's also, everything's changing really rapidly. And I think an example of that is the digital food environment. The food industry does move rapidly, and it's really important to keep up, I think, as well with those conversations. And that's a function of research. And I love that it's being translated, and we have those platforms to share that translation. And again, we do have a digital food retail community of practice that's led by Adya Gupta, and that's where we can have these informal conversations and we can revisit our plans that we might think a tool is needed in a certain way, but it can be adapted according to the current knowledge.
Thanks very much. So I am going to throw 2 questions from the floor in about 5 minutes. So do make sure you're entering your questions and putting your thinking caps on. But before we do that, I want to kind of now push a bit beyond the partnerships question and a bit more deeply into what do we need to be thinking about as people jointly concerned about our food retail environments, and think about the boundaries that we've got at a local or national level. And so a lot of what we've been talking about are projects that are local to a particular state, some of which are becoming more national. And I just would love people's reflections on how we might be able to push some of these partnerships beyond those current boundaries to more of a national level or even global level, given that so many of the challenges that we're facing are actually global health challenges. And I thought I might start with you, Sheridan.
I think that's a really interesting one, particularly working in a state government health promotion agency. A lot of the work that we do is specific for the Queensland consumer and is designed to be that way. But from a research perspective, I think considering that scalability from the very start of a project is important, and how we can start to scope the different pieces of work that are happening across the world. And I think we're getting better at that. We seem to have better connections and better idea of what actually is happening. And the more that we can come together in a forum like this and talk about it and share connections, the more we'll be able to translate it into other spaces.
Yeah, thanks very much. Bridget, are you happy to add to that?
I think to Sheridan's point, there's so much happening. We do quite niche work. So, it's really good to hear when somebody else has done this, and often the international context is applicable and relevant. I guess where to look, how to find that. I don't really know where to start. So I think making clear and establishing some of those channels. I mean, we're all very well connected in this room, but how do we go broader and do the equivalent in an international setting?
Yeah, I think that's a great segue to Vic to sort of perhaps reflect on some of our communities of practice that have extended nationally because it was a joint national need would be really useful.
Yeah, absolutely. Nourish Network did start out Victorian based, and it was just an organic, beautiful expansion nationally, and it's now reaching internationally, which is wonderful because there are so many people working globally, nationally and globally, towards this really important cause. And so, yeah, where to capture those learnings, that is the $1 million question. And I think, the Refresh website and the Nourish website and the contributions from all our members, these need to be places where we can find resources and connect in networks as well. So we really value being a hub, whether it's for information or connecting with others in the space.
Yeah, and just to add to that before I throw to Talani for some global perspectives, I think one of the things that we have learnt through Nourish, through webinars such as this, is when we put on a webinar, like for the health services, food retail environments, we do get national attendance. And I think we had underestimated that potential for that national reach. So although obviously every jurisdiction has its local context, a lot of the learnings that were being shared in the chat and through follow-up emails to the speakers really were quite exciting to us, because it made it clear that, yes, we want to do the research, but also just the networking function brings a lot of value, I think, in terms of allowing people not to reinvent the wheel, but also obviously to think about practical strategies as well as kind of the research that Bridget was talking about before, in terms of that really direct bespoke research for their toolkits or their practice approaches. So Talani, would you like to give us a global perspective? I'll be quite interested to hear, particularly from your UNICEF work, how you found that linking of what we know globally to what we know locally, and what's tailored and bespoke and what is quite generalizable.
Yeah, that's a good question. And being working in a context so different from the context that we live here in Australia, which is in East Asia and the Pacific, it just makes us valuable more and more the partnerships that we have with the local partners. So beyond the UNICEF partners in each country, we have local research partners as well, helping us to develop the project. And I think sharing the experience that came before what we're doing, it's really important to learn from them and then to build from them. So as you mentioned, we don't want to reinvent the wheel, but we wanted to build on that and being opportunistic as well. So sometimes that is an opportunity through a company or through our organization to work in a small project that can grow. So taking those opportunities to start something, it's really valuable.
Thank you. Now, I think we've got a good 15 minutes for questions from the floor and questions from the Zoom room. Do we have any Zoom questions? Not yet. Have we got any questions from the floor? So I would encourage you, we've got a great attendance from people on Zoom, so please do use this for your benefit. If you've got anything you would like to know or any of your reflections that you would like to share about having a research policy practice partnership work, we'd love to hear it, both in terms of learnings we can share across the sector, but also things that we can build to support that kind of partnership further. Anyone from the room got any questions? Yes.
Thank you. My question is for Tailiani. I would like to know, how do you manage all these partnerships or all these people together? There are sometimes many leaders that want to, I don't know, have a higher, I don't know how to say, but maybe a higher voice, or, you know, a louder voice. And how do you manage all of those egos? And I don't know, sometimes there is power imbalances, and I'm just curious, how do you manage those?
Yeah, thanks, Carolina. That's a good question. And I think I am the project manager from the research side. So UNICEF is actually the leader of the initiative. And I have been really fortunate to work with them because I don't have experience that ego voices as we always, sometimes we experience that. And it's been really everyone in the same page and together to make the difference. So although we have, of course, high-level managers from UNICEF attending meetings, and sometimes we have like early career researchers, which are totally different levels, but they're all in the same page and trying to make the effort to agree or putting the views in the table. So we try to make sure everyone is comfortable when they're speaking and that the ideas are taken account when we have decisions.
So not so much a question, I don't think, maybe a reflection, but just Vic and Shannon, when you guys were talking about the Healthy Retail Toolkit and that expanding to Queensland and the online training, I think it's quite interesting that the START map, which was done by, you know, a collection of people, and the paper that was published from that, I think the paper still only has maybe 10 citations, and half of those are from people citing ourselves or citing themselves. However, it was a conversation that Tara, Miranda and I had, is that the impact of a paper should not be judged solely on the number of times it's cited, because that project has gone on to, you know, from that we then did the online training using the START map that went to Amsterdam UMC. It was presented in Rome. It's now up in Queensland. So yeah, just I guess an observation that it's not purely about impact, is not purely about number of citations you get.
No, I think that's an excellent point, and I'll open it to the panel in a moment if you've got something to add on that, because I think our hope is that not only do so many researchers actually want to have that impact, so it's a measure of impact that is meaningful to the researcher, but I think our hope is that funding organisations more and more are actually going to respond positively to that sort of impact. So one of the things we think a lot about is how do we capture those impact stories. So a traditional research outcome would be, yes, I've got that paper, and then we got this grant, and then maybe we got another paper. But I think we're starting to think much more creatively about the case studies that we capture around these impact pathways And that's where we're so grateful to so many of our partners like Bridget and Sheridan and so many people online and in the room for taking that extra time to help us develop those case studies over and above the actual work that we do. And I think that is critical to building that kind of impact research. But I'd be really interested to see if anyone on the panel had something they wanted to add.
I think obviously the citation is very tangible, but when I read that paper, and I read a lot of papers, there's no citation that comes from me, but that's evidence in practice that I then, disseminate further to health services. So I guess it doesn't give you the physical number that you're perhaps striving for, but it's not to say it's not of value. And I guess the ultimate goal is that evidence is put into practice, and it most certainly is. So I think hopefully that's reassuring.
Yeah, and at Nourish Network, we try to look at measures as well, try to identify, are we adding value, how are we helping? And anecdotally, I might hear, oh, we've used this tool or we use it in professional development, and that's so fantastic to hear. And so we do have KPIs that we've set to understand impact, and it does require a little bit of creativity, as Anna was saying, but that's also part of it, I think, is putting out surveys and understanding what people want and what value that they are deriving from what we're doing.
Sheridan, no pressure, but did you have anything you wanted to add before I go to the next question?
Just really to agree with what Bridget and Vic said, and that experiential evidence is, I think, really important. And in the context of this current project that we're doing and the Start Map training that the health practitioners are going to engage in, I would expect that they're going to find that incredibly useful, and the rest of our health services are going to want to have access to it. And as we start to expand our food environments approaches across other settings, it's something that will become a standard tool or a resource that we can offer to people, and that's how we're going to have the impact.
Thanks very much. And I think we do have a question online, which Sian's going to read out. Thanks, Sian.
Sure. So this one's probably more of an expert opinion, but there's lots of potential for schools to have an impact on healthy food supply. When do you think there's going to be some funding directed that way, or investment in the foreseeable future?
Well, that's a great question. I can start on the funding, and then I'll throw to Vic for how Nourish Network is trying to expand to support that area. And then anyone else on the panel is also welcome to join in. I think that research funding is through the traditional pathways is not going to expand anytime soon. But I think what we can more cleverly do is merge our partnership grants, if you like, things that are really built on strong research practice policy partnerships to address these needs. So I think if we can target partnership grants in that direction, they're quite likely to be successful because they're highly feasible projects. So while I don't expect targeted calls anytime soon, I think we certainly can try and get funding for that kind of really impactful research.
Thanks, Anna. Yeah, so absolutely, schools are an important part of the picture here. I think I think everyone probably here and online understands that having children and educating them on what's healthy food is really, really critical. So yes, we have set up an interest group around schools, and I think the most important thing will be connecting the great work that's being done by canteen associations and linking them with researchers, and again with tools and practice, and helping to further their capacity to enact change, and whether that's also the advocacy piece and the voice to connect them with policymakers to help support them to make healthy changes is really, really important in schools.
Did anyone else on the panel want to add to that? I mean, just to follow on from what Vic was saying, if people are interested, do reach out, because it is a new community of practice that we are building, really leveraging off some of the great work of QUAST, so the Queensland Association of School Tuck Shops, who actually have developed a whole lot of tools in this space. And in recent conversations, it's been clear that there just isn't funding to evaluate those tools. So that's what we're really keen to support through Nourish, is a network of researchers who want to know how to support evaluations and demonstrations of impact, and practitioners who would like to be involved in that. And I think that is a really feasible research grant, to be honest. I think it's a winner. So if you're interested, let us know. There's a question in the room. Thanks.
Thanks, Anna. It's Adrian Cameron here from Globe. I've got a question for Sheridan. I was interested in what you said before, that you approached Refreshed to get answers to your questions you had about what was going on in government and how to implement your research. I'm just interested in your reflections on whether you think as researchers we should be being more proactive in approaching governments, whether you think governments, should be more proactive in approaching researchers. How do you think that relationship between policymakers and researchers, how do you think that should be brokered?
Thanks, Adrian. That's a great question. I think it's probably a bit of both. I think for us, it was never really, when we approached Deakin, it wasn't about building a partnership. It was really about that knowledge sharing and getting advice about all of the research that's happening out there. And I think that would probably be my main reflection, is that research doesn't have to be a opportunity that's created on a side, an additional thing that we're doing on top of our workload. It can be something that becomes a part of our business as usual. And that's what I really love about the current project that we're doing with Deakin, is that it's all things that we were doing in Health and Wellbeing Queensland already, but that Deakin were also doing and trying to do research into. So I think it's just, again, about that networking, building connections, and just knowing what is happening across the country and globally, so that we can build the connections and kind of integrate into each other's work as much as we can.
Yeah, that's a really useful reflection. Did you have anything you wanted to add, Bridget, from kind of a not government, but government organisation perspective?
Sure. So I guess being quasi-government, I don't quite have the influence to make policy. However, we do play a strong role in advocating and advocacy. A lot of the feedback and the conversations we have, we do escalate. And where we believe in something or passionate about something and see value in it, we'll most certainly push it up the chain. So I guess it's not overlooking those opportunities as well. If it's not necessarily government, but someone who's closely affiliated or an organisation that has leverage, is still a fantastic opportunity and way of getting that attention still.
Thanks very much. I think there's another question online. Thanks, Sian.
Sure. So how do the panel members cope with different expectations? For example, timeframes.
Such a great question. That's my favourite question. I'm going to start at the other end of the panel, then you can pass the mic back. So over to Talani.
That's a really good question. And good research takes time, and sometimes the practitioners don't have that time to wait. So we're trying to manage expectations and show them the value of doing things with a lot of thinking around that, to don't waste time. So sometimes we want to do things quickly, which end up not being the best of what we could do. So research, and good research, as I mentioned, takes a lot of time. And it's good to, at the beginning of any partnership, to put that expectations about timeframes and timelines early in the table, to make sure everyone are comfortable with that.
Understanding, I guess, everybody's respective deliverables. Something that I often advocate for, successfully or unsuccessfully, is getting a version of something incomplete. So we don't want it rushed necessarily, but we don't need it to be perfect. Could we have a draft version in confidence, strictly confidential, but it's not a surprise to us when this research comes out. We have the opportunity to be on the front foot and be a bit ahead. And I know there's hesitance, and I understand the reasons for that, but it is greatly appreciated where there is a preliminary version of something, or ideas, or just a heads up that helps keep things moving and prevent any surprises, I guess.
Yeah, I'd like to reiterate the communication aspect that we started talking about. And as Talani mentioned, I think communicating expectations, deliverables, it's really, really important to set that right from the beginning, so everyone knows what's happening there, and they can feel positive about that. And also reiterating the goal and the objectives, so everyone can stay focused on that throughout the process.
Sheridan.
I think there's nothing like getting in the room and having a conversation. And I think the more that we can do that along the process of a partnership, the better we can create. Instead of creating programs that fit research, or creating a research program to fit around a program, we can do it together. And I think that, just those open channels of communication are going to help to avoid any issues.
Yeah, I think they're really excellent comments. And I think what I would add is I also think one of the things that excites us as researchers is trying to be a little bit creative in what are some other methods then we might be able to explore that might be quicker in a particular context. So, even things like, rapid evidence synthesis, I think, researchers have moved from the 6 to 9 month systematic review to a 2 to 3 month, rapid review, and now even to a 4 to 6 week evidence snapshot, where if you're really clear about the expectations and are very transparent about the levels of kind of thoroughness and the depth of the evidence, you can deliver different sorts of research in different sorts of timeframes. And I think, again, a lot of the partnerships that I'm aware of around the room, they often will start with, I don't want to say quick and dirty in a negative way, but a quick and dirty partnership where we really are opportunistic and we see there's a need and we can do a quick evaluation to move that policy or practice area along. But in doing that, we learn how might we actually build those methods to be more robust? How can we collect data that's going to be more useful? How might we next time make it both a bigger project, but also a more robust project? And I think perhaps thinking a little bit more about the different lines of evidence and the different lines of research that we could be doing in parallel is another way to build these research programs and partnerships. So I am aware of the time. I'm just looking at Sian. Oh, there's one more question online. Excellent.
So the person online is looking for advice of how to engage retail environments that are very concerned about their profits in terms of activities to promote healthier retail environments.
That is a fantastic question to finish on. So I'm going to start with Victoria and pass the baton that way this time.
Yes, thank you to the questioner. That is absolutely a very valid point, and we appreciate that retail is a business, and there's been extensive research done, and so happy to draw on that to show that there is really great evidence to indicate that healthy options are in demand, that customers do want those. We understand cost of goods sold is always something that retailers are interested in. And as I said, there have been extensive studies done to show that there are options, and agencies like Healthy Eating Advisory Service, Health and Wellbeing Queensland can show how that can be done effectively and profitably to bring in those healthy changes.
Thanks, Vic. I have these conversations many times. I think the approach I always take is a foot in the door approach, that you start with one drinks fridge. You don't aim to conquer the whole retail setting. You start with a drinks fridge and you say, we'll try this for 4 weeks. If it doesn't work, we'll come back to the drawing board. It's not a measure that needs to be sustained forever. So I think that's really important there. And I think acknowledging from the front foot that, yes, you respect this is a business, it seeks to make money, it needs to be viable. I think that goes a long way to demonstrating that you understand and you are there to support them in that objective. So
yeah, I completely agree what Bridget just mentioned. We can start small, we can test things, and how from the research side, we also can test what is good for health and what is good for business as well. So we make sure both sides are happy.
I think this is one of the examples where that contextual evidence is really important. And I know here in Queensland, there is a lot of data out there about how healthy food retail initiatives don't impact the bottom line, but there's little from Queensland hospitals. There's only one study that I know of. So it's really hard for us to go to retailers and tell them that this isn't going to be the case when it's not the reality of their world. And I actually think that this is something that we need to turn our attention to more as health practitioners as we move forward. The cost of living is obviously an obvious barrier for us, and the cost of food, not just for individuals, but for retailers. We had one of our health service retailers come to us recently and say, whilst they really want to promote healthier options, it actually costs them $8,500 a year to put low-fat cheese in their products instead of full-fat cheese. How do we transfer that cost away from the retail? How can we expect them to actually take that hit to their business? And I think there's more that we can do, more exploration and more support for retailers.
Yeah, I think they're really excellent points. And I'd add a couple of things. I really endorse the try something small and support them to try that. And I guess some of the things we've learnt, I mean, there is a large body of evidence now. I agree, not in every jurisdiction and every setting, but a lot across Australia demonstrating both customer satisfaction outcomes, which is often one of the pivotal ones, and whether there is a hit to the overall revenue in a drinks line or in a food line. So I think if the questioner is looking for that kind of resource, then as Victoria said, you can look on the Nourish Network website, the Refresh website, HEAS, Health and Wellbeing Queensland, or just get in contact, because one of the things we are aware of is there's resources are also scattered. So we are going to try and synthesize those and bring them together more, but definitely get in touch. And I think the other thing in terms of that local context that we've learned is sometimes you can partner with a researcher in a small project to help actually that retailer evaluate as they go and build their own evidence, which can be quite compelling for that retailer, because then they become a champion for change, as well as testing in their own context whether the small kind of nudges that you're supporting are actually working. But it's definitely one of the biggest questions, as people have said, in that cost of living era. So I am going to draw it to a close. It's been a really fantastic discussion. So a big thank you to everyone who's stayed online for the last hour, and everybody also in the room. And also a large thank you again to each of our panellists. It's been fantastic, and to the organising committee. And I think I will close it there because it is exactly 2:30, but it's been fantastic. So please join me in thanking the panel. And just to close again, if you do want support or help or networking, then do reach out to nourishnetwork.org or Refresh, or anyone who sent the invitation to you. And we'd love to support you in trying to transform retail environments for better health of people and planet. Thanks again. Thanks, Sheridan.
Thanks, everyone.